After 6 weeks of tough stage 4 lockdowns, Melburnians are waking up this morning to some small new freedoms. In a move that will have many parents jumping for joy, playgrounds can reopen and people will be allowed out of their homes for an extra hour. Some of the rules around visitors to private homes will be eased, particularly for those living alone. There's also some easing of restrictions for regional Victoria.
Yesterday, the state government unveiled a $3 billion package to help ailing Victorian businesses, but anger at continuing lockdowns boiled over again with violent confrontations at Melbourne's famous Victoria Market. Police made more than 70 arrests. For his take on it all, including that stoush over borders, we're joined now by the Commonwealth Deputy Chief Medical Officer, Dr Nick Coatsworth. Nick, good morning. Welcome to Breakfast.
Good morning, Lisa. Thank you.
Should we be sort of starting to get a little bit worried about the frustrations that seem to be boiling over in Victoria and whether enough people are still going to get tested?
Well, Lisa, one of the things that I'm acutely aware of is if you're not in Victoria at the moment, it's very difficult to understand the pressures that are brought about by the stage 4 restrictions in Melbourne and the surrounds. But that said, they are clearly having the desired effect. That light at the end of the tunnel is growing bigger by the day. But 20 cases yesterday that have as yet been unlinked, that is still a number that's too high. And we need, of course, for everybody with symptoms in Melbourne and indeed Victoria to make sure they're getting themselves tested so we can understand those transmission links and the public health unit can shut them down.
Yeah, it's those mystery cases that keep bothering us all. Where do you see the numbers tracking? What do you think the trend is?
Well, I think the trend overwhelmingly is in the right direction. We're coming down off the second wave now in Victoria. It will be important to see the trend of those unlinked cases, those mystery cases, and if we can keep those heading down towards single digits, then that will be a very good indicator that progress can be made in the right direction.
Lots of criticism of the curfew, though. Do you have thoughts about that?
Well, the curfew obviously was intended to restrict movement, as were all of the stage 4 restrictions. Unfortunately, I'm not able to just talk about it in too much more detail. It wasn't something that was discussed at the AHPPC. It hasn't been a policy that we have discussed or promoted at the AHPPC level. But it was clearly a suite of the policies that the Victorian government chose to introduce with the overall aim of lowering movement, which we know slows the spread of the virus.
Can I ask you about something else that has been discussed at the National Committee of the Health Officers, and that is borders. The agreed approach, which I understand is the information that then the Prime Minister is working on, is that borders should be open. But you've got the Queensland Health Officer, Jeanette Young, you've got the Victorian Health Officer, Brett Sutton, on this national committee, and both of them feel very differently about borders. So who's right? Why are we having this sort of internal debate, I guess, between the health officers?
Well, first thing I'd like to say is that Dr. Young and Professor Sutton, amongst all our chief health officers, are extremely experienced public health officials. There is a debate about borders and movement, and that is largely related to risk tolerance, Lisa, and whether one is prepared to allow any possibility of COVID-19 entering into one state. Of course, there is a state in New South Wales that is relying very effectively on test, trace and isolate, and has managed to keep numbers down for well over a month now. And of course, that may be that likely is the way of the future. We may not see a vaccine. Could be anywhere between January 2021 and December 2021. So we need to have these ongoing border discussions. They're obviously a live issue. and the definition of what a hotspot is, or can I prefer to say a geographic area of concern, is still a live debate within AHPPC. But I think your viewers can be reassured that those are positive, they're constructive debates and they're ongoing.
Yeah, but Jeanette Young is really copping it. I mean, it's been a very personal attack on her. Is she pulling the wrong rein on this, on the advice that she's offering the Queensland Premier?
Well, personal attacks are not appropriate to our chief health officers, or indeed our chief medical officers. I've suffered a few myself, and people are making the best decisions on the best advice that they have for the people that they're responsible for, which are the Queensland people. But whatever assistance we can provide the Queensland government in that decision making, and Dr. Young, it's all on the table, including support for enhanced public health response in the event that there are more wide-scale outbreaks in Queensland. But they've done a fantastic job in controlling the southeast Queensland outbreak, and that should give Queenslanders a lot of confidence about the ability of the Queensland Public Health Unit to control COVID-19 at low numbers.
Dr. Nick Coatsworth, thanks very much.
Thank you.
Tonight, 7:30 reveals new data showing cancer tests and operations across Australia plummeted by up to 50% during lockdowns back in April. Experts had predicted a significant drop, but this is the first time it's been confirmed by data. Figures provided to 7:30 by the government's peak cancer body reveal that skin cancer treatments, breast cancer imaging and colonoscopies all fell significantly during March and April. Israel will go into a 3-week nationwide lockdown to contain a surge in coronavirus infections, the first country to reimpose serious restrictions on a national scale. People will be banned from moving more than 500 metres from their homes, and all but essential shops will shut. Victoria has recorded 35 new cases of COVID-19, 7 deaths sadly recorded. Now, today was supposed to be the day Melburnians emerge from tough stage 4 lockdown. Instead, with the lockdown extended, they'll have to make do with a few small wins, like the opening of playgrounds and a slight easing of rules around visitors.
Anger at continuing lockdowns boiled over yesterday with violent confrontations at Melbourne's Victoria Market. We've got Stephanie Ferrier on the ground in Melbourne and Alexia Atwood, who's at Bondi Beach in Sydney, where authorities are planning to use some new crowd control technology to slow community transmission. We'll talk about that in a second. I'm a bit interested about that, Alexia. Steph, we've got 2 bits of good news: lower numbers and restrictions eased a little bit.
Yes, those lower case numbers today, 35 new cases is the lowest that we've seen in a couple of months. And that obviously takes our 14-day average, I've just done a very quick calculation, down to 56.28, but that doesn't take into account any duplications from those 35 figures today. So obviously when the Department of Health comes up with that, that number will reduce even further. Sadly, as you mentioned, another 7 deaths. That takes Victoria's total toll to 730 now. But just in terms of today, we obviously have a little bit of a taste of freedom. We'll take anything we can get at the moment. And for those that have kids that are climbing the walls at the moment, well, now they'll be able to climb the monkey bars behind me instead. You can see that the tape is up at the moment, but that is going to come down today because playgrounds are reopened. So too is outdoor exercise equipment and click and collect for libraries as well. For people who want to go out and exercise, well, that's now increased to 2 hours, and you can also do recreational activities as well as exercise as well. And there are also going to be a little bit more time in the day to be able to enjoy that outside time too, with the night curfew not starting until 9 o'clock. There'll also be those new social bubbles for singles who've been doing it really tough in isolation in lockdown. They'll be able to connect with another person. In regional Victoria, the rules are even more relaxed. They actually moved to step 2, which means that they'll have 5 people from 2 different households allowed in outdoor gatherings. They'll also have outdoor swimming pools, and they will even get further restrictions, probably reduced by the middle of this week. The Premier says it's unlikely we're going to be able to move out of these curfews and businesses can open before that October the 26th date. And of course, Anger about that boiled over with anti-lockdown protesters converging on the popular Queen Victoria markets. Who would have thought before 2020 we would see riot police down in the middle of fruit and veg aisles? But they did arrest some 74 people. They handed out 176 infringement notices, and a chief instigator that they allege is the chief instigator, well, he was arrested and he's expected to be charged with incitement.
What's the response to the package that Dan Andrews announced yesterday?
Yeah, so this was a $3 billion lifeline, which takes up to $6 billion, the total amount that is being offered to businesses in cash grants, in tax relief and in cash flow support. We heard from the Victorian Chamber of Commerce and the Australian Hotels Association saying that they believed that it was a step in the right direction and they gave it the nod of approval, but many businesses are saying that it is just too little too late to avoid them going to the wall. We're also hearing from the government that they are now putting the finishing touches on a relief package for sole traders, those very small mum and dad businesses, and hopefully they should be able to release that package imminently.
All right. And Alexia, over to you at Bondi Beach. What are they doing there to try and stop community transmission? Because I tell you what, the warm weather, it's going to be hard to keep people off the beach.
Absolutely, that's so true, Lisa. And as you can see behind me, the physical distancing is pretty good, but summer is fast approaching. The weather is beautiful, so we are expecting much higher numbers on the beach. And so as a result, there's going to be more cameras and more drones feeding in real-time vision of the beaches to a new state operations centre for Surf Lifesaving New South Wales. So that's going to help them better monitor for drownings, but also keep an eye on the level of physical distancing. And you will remember in March, Bondi Beach was shut down because the overcrowding was intense, and many of the beaches along the coast here were also closed, unfortunately. But the New South Wales Police Minister, David Elliott, says he hopes that isn't the case this summer. We all need to be able to get out to the beach and have a break. It's been a tough year, but there is a serious hope that people do keep those levels of community transmission down by staying apart from one another. And just to give you an update on the New South Wales figures, we do have 9 new cases in New South Wales. That's 4 in hotel quarantine, 1 is a mystery case, and 4 are linked to known clusters.
All right, Alexia and Steph, thanks very much.